Hi, thank you for coming today. My name is Sue and I'm here to talk to you about Medicare. I don't know if you were aware of the headlines that just came out in the August 10th, 2013 edition of Tulsa World. The headlines read that the U.S. government was initiating fines against 50 hospitals in Oklahoma state alone. And that fine is related to Medicare readmissions. In addition, they were fining 2,225 hospitals across the country. So, I'm here to put forward the notion that home health care should be mandated as a discharge order on all Medicare recipients after a hospitalization. Home health care will help to reduce readmission rates, improve patient satisfaction, promote patient safety, improve patient outcomes, but more importantly, it can significantly reduce Medicare and Medicaid spending. So why is this a focus right now? I'm going to give you some statistics, and it's pretty staggering. U.S. News and World reported some pretty staggering numbers here. Currently, right now, it costs approximately $1,600 to $2,000 a day per patient for hospitalization, and hospitalizations contribute about $850 billion out of the $2.7 trillion per year that Medicare is putting out. 1 in 5 patients are actually readmitted within 30 days of being discharged from hospital. That's pretty staggering. 12% of those are actually preventable. Those 2,225 hospital readmissions actually total almost $227 million. However, a nursing home is not really a viable option either. Currently, that is running $70,000 to $100,000 a year per patient, and most Medicare recipients run out of money within 6 months. At that time, they must resort to Medicaid, which is the state funds. So not only do they deplete their own funds, they also contribute to the depletion of the state funds. In addition to that, 90% of nursing homes lack adequate staffing to be able to provide even the basic care. And as we look to the future, things look dismal as well. In 2011, Kaiser did a survey, and they are predicting that in 2030, there will be an increase in Medicare recipients to the tune of 72 million people. And at the same time, each Medicare recipient will experience a decline to 2.3 people working per Medicare recipient. Currently, we have 4. At the same time, 22% of the baby boomers right now are actually living with 5 chronic diseases. That further taxes our healthcare system. Medicare is telling us that by avoiding even 1 in 10 readmissions, they could actually save approximately $1 billion every year. So can home health actually make a dent in this? These are pretty staggering numbers, but I can tell you that we can make a difference, and I'm going to show you how. On this visual aid, you can actually see a picture of the difference that we've made. The red numbers, the bar graphs actually show hospital readmissions on patients that were not enrolled in a home health program. The blue represent patients who were enrolled. The difference in between the two graphs actually reaches a total of $1,234,845, and that was the annual savings on the difference between those two. This is only 5 agencies in one state, and that's the state of New York. This is based on Medicare's standard approximation of a hospital readmission stay, and the company, Simeon Consultants, which you can access this study, actually said that the numbers would be significantly higher in the state of New York because their hospitalization rates are higher. So if this is the savings from 5 agencies in one state only, imagine what we could do if we took this concept and spread it across the country. So why are readmissions a focus? Because as Medicare predicted, they can be prevented. Readmissions are caused from some pretty simple issues that we can focus on in home health care. Things that are related to problems with medications. Patients have complex medication regimens as they come out of the hospital, or they're new regimens that they're not familiar with. They're not having adequate follow up with their primary care physician, or there's a lack of communication with their physician. Sometimes, quite simply, the family cannot handle or deal with the health care at the home. We're also finding that patients are much more receptive to being taught or shown how to handle their health care or their medications or their symptoms in the comfort of their own home, as opposed to a more clinical setting as you find in the hospital or in a doctor's office. When it is done right, home health care is a win-win for everybody involved. So in conclusion, I would like to say that ordering home health care on discharge for Medicare recipients will definitely reduce readmissions. It's been proven from this model. It will also benefit the patients. Home health care not only results in fewer admissions, but it improves patient satisfaction. It improves patient outcomes. The home health nurse in the home can catch errors before it grows into something catastrophic. We can also impact savings at the state level with the funding. And I think that we owe it to the future senior generation. We need to be smart consumers of Medicare now. This is something we can implement now with systems that are already in place at absolutely minimal cost or no cost to the hospital as an organization. I would like to open it up for questions now.
Would all Medicare patients qualify for home care services?
That's a great question. Medicare has some strict requirements for qualifications, and you can access that on their website at www.cms.gov. Medicare patients have to be homebound, which means it must be a considerable and taxing effort to leave home. They must be under the care of a physician who will sign a plan of care. They must receive skilled care in the home, and it must be intermittent. Are there any other questions?
What kinds of things are home health agencies doing to reduce hospitalization?
Every home health agency is allowed to incorporate their own plan as far as what they can do to reduce readmissions to the hospital. What is really catching fire right now across the country is a notion called care transitions, and you can access this at www.caretransitions.com. They have excellent resources and excellent tools to download there for you and family members. The notion behind care transition is that it is patient-centered care and it is patient-driven. It allows the patient to manage their own health care, manage their medications, and be able to communicate with their healthcare provider on their own. Thus, they direct their care. Thank you.